What are some of the best things that people can do in terms of their sleep hygiene, sleep practices that can help them optimize their performance day to day?
First off, like the very first step I tell people is to wake up every day at the same time, Monday to Friday, even on the weekends.
Mm-hmm.
If you prioritize sleep, as like something that's important to you, that's what you're going to do. And then go to bed only when you're feeling sleepy, which can be different from night to night, so that you're not forcing yourself to go to sleep by a certain time, which will be a recipe for insomnia, right? If you don't feel
sleepy. Okay.
Exactly. That head nodding feeling. Try not to take naps during the daytime. If you're an adult, 18 to 64, you might not, if you take a nap during the daytime, particularly if it's too long, when I say it's too long, more than half an hour, in duration, that's going to take away from your nighttime sleep, right? Whereas we want to consolidate that sleep at night, fall asleep quickly, stay asleep the longest we can. Practicing good sleep hygiene, right? The things I mentioned, exercising, but not too close to your bedtime, having, decent, having a good diet, but not having a big meal close to your bedtime, no nicotine, light exposure, caffeine intake close to your bedtime, making sure your sleeping quarters are cool, dark, and quiet. If you're up in the middle of the night, like I said, don't make an association between your bedtime and your bed. If it feels like it's been a long time, just go to a different room, do something boring, like a word search.
If there was one thing that you wanted to sort of share with the world in terms of what you've experienced and seen and treated, what do people need to know about sleep?
Well, we spend a third of our lives sleeping, so why not make it as comfortable and enjoyable as possible? If you think you have a sleep issue, get help, whether it's medically or whether it's change your sleep environment. And then that way, I think you're going to be healthy, and I think it's going to help you in your life in all facets.
We live in a culture obsessed with performance, tracking steps, chasing personal bests, and optimizing focus. But the real foundation of strength, clarity, and longevity isn't found in a supplement or an app, it's sleep. Not just rest, but a dynamic state where muscles rebuild, the immune system recalibrates, memories consolidate, and the brain clears the waste that slows us down. Each night, the body cycles through light sleep, deep restorative sleep, and stages of rapid eye movement called REM. Miss them, and you don't just lose hours, you lose your ability to adapt. Deep sleep cements knowledge and repairs tissue. REM sharpens skills and emotional resilience. It's not optional, it's the beautifully simple key to a life of peak health and performance. Not built on hacks or shortcuts, it's built on rhythm and discipline. Anchoring your wake-up times, harnessing morning light, and training the brain through proven strategies. All of it working together like conditioning for your nervous system. Even the brain's own cleaning crew, the Glymphatic system, only comes alive when you sleep, sweeping away toxins linked to neurodegeneration, protecting you from disorders like Alzheimer's. If we care about long-term cognition as much as physical power, this is where the real edge lies. To help unlock this, I'm joined by Dr. Michael Mack, doctor, psychiatrist, professor, and one of the world's leading experts on sleep science. Join me in Vivo with Dr. Michael Mack on peak performance through better sleep. Dr. Mack, you're an MD, a psychiatrist and sleep medicine specialist at CAMH, which is the Center for Addiction and Mental Health here in Toronto. You're a professor at the University of Toronto and McMaster University, a researcher at Western University focusing on insomnia management, sleep disorder and psychiatry, and tech innovations like VR. And you hold leadership roles in organizations such as the Canadian Sleep Society and American Academy of Sleep Medicine. And last year, you were awarded the Paul E. Garfunkel Award for Best Fellowship Supervision. It's an honor to have you here, Dr. Mack.
Thank you for having me. Yeah.
Now, there's something that we all share in common and we experience ideally, and that's, not just tax and death, but it's sleep. And we don't usually think about it until we're deprived and regretting some of our life choices. And then in the, worst case scenario, you've got some sort of pathology that's related to sleep, which is what you deal with on a daily basis at CAMH. In either case, we all know quality of life goes down when your sleep quality goes down, sleep efficiency, sleep time, all goes down with it. So I wanted to do a masterclass on sleep, sort of, what is it? Why do we sleep? How can we optimize it to better perform day to day? And I couldn't think of anybody better to have on than you. First question though, with a CV and schedule like that, how do you find time for 8 hours of sleep?
I mean, time. I mean, sleep time really. I mean, time in general is like sort of the most valuable resource.
Right.
So, I mean, sleep is like such a great, scientific endeavor for me. I think that a lot of great scientific breakthroughs are probably going to come by way of sleep science and sleep medicine. So I'm just delighted to be part of it.
Now, why don't we step back before we get started and just talk a little bit about your history? How did you get involved in sleep science and sleep medicine? As a med student going through med school, eventually sometimes you have to do a specialization, and you chose to go down this path. What got you interested in that?
It was just by coincidence that like a supervisor that I had in medical school did sleep medicine, and you had to sign up in the middle of your second year of medical school to observe like different doctors in different fields to do clinic, and I signed up to do this clinic with him, and I couldn't believe that you could sit and do clinic and talk to people about sleep and improve their sleep health. And it's just, so scientifically, interesting to me. The cases are interesting to me, and to serve our patients is also, very rewarding. So, I just lucked out.
Now, like I said, sleep is something that we all, have in common, and we don't think about it much. And it seems like a silly question, a good place to start, but what is sleep from a scientific perspective? What happens to the body on a physiological level, cellular level, molecular level? What is happening while we sleep?
Yeah, like sleep is a time of rest and restoration, but counterintuitively to what we'd expect, it's not a passive process, right? We spend approximately a third of our lifetime in sleep. It's absolutely crucial to life. Another person, sleep scientist, Michael Grandner from Arizona, he termed it best, which is sleep is a non-negotiable part of life. So we know that it's involved with memory consolidation, learning, growth, repair, and saving energy, right? These are all things that are evolutionary beneficial. So it's an important part of life, and we need to spend more time focusing on it and making the best we can.
What you said it's not a passive pursuit. What do you mean by that? I mean, obviously you mean it's an active pursuit. How so?
Mm-hmm. So it's when we're asleep, it's not just as simple as your computer going to sleep mode, you're closing the lid.
Right.
And we're just saving energy. So part of it is energy conservation, being that, for survival, it's, quite hard to historically speaking, of course, to, take in enough calories for survival. So there is a survival advantage to having some downtime where you don't have to, consume as many calories as you would otherwise. But it's also, a time when your body builds itself. When you were young, before, vertical growth was finished, we'd be growing vertically. We don't grow during the wake, during the daytime, we don't do that. And we all go to school, and we've all had to, do study for tests, exams. And, the truth is that, a lot of, what we learn, for it to become part of our long-term, memory, to be something that it can be pulled as needed, facts and procedures and learning how to do things in a certain order, that happens at night, that happens in sleep. And, being that we consume fuel, food that we take in, and, we have waste products that get built up, that's the time when those things get shuttled away and, the brain does its cleanup.
Right. I want to get to that. You're referencing the glymphatic system. That's a very interesting topic. I want to get to that, but I feel like we're going to go on tangents right away here. You said we grow while we sleep. Now, growth pains during night, is that an actual phenomenon? A lot of kids experience it in their legs.
People experience growth pains, but, is it like a pathology? Is it like a problem? Maybe not. There's many reasons why a person might have that experience. But as long as it's not a lasting, experience, then we're not too worried.
So, but the pain that children often feel in their legs when they're sleeping, is that actually due to growth? Or is this a psychosomatic thing or something else completely?
The short answer is that it's complicated.
Okay.
It's complex. It's hard for me to say and attribute it to any one thing. Growth in general doesn't involve pain. Sometimes in the interim, in the short term, there might be some discomfort. But if there is pain that's lasting, that's when you need to see a medical professional. That's what I'll put it. That's what I'll say about it.
Interesting. And the other thing that you mentioned, like again, tangent, memory consolidation, learning while we sleep. Is there any evidence to show that you can learn something while you sleep by listening to something?
That is probably not something that works.
Okay.
We are able to process auditory information while we're asleep. So as an example, if something calls your name, you're asleep, you're taking a nap, you're going to wake up. You may not wake up to, other words. If you leave the television on, you might just stay asleep. So there are things that your brain is processing, from an auditory standpoint, but whether that can be used as a learning process, I don't think so.
Right. Okay. Good. Okay. We often hear about stages of sleep. Quick definition of those stages and why it's important to hit why it's more important and less important to hit some of those stages.
Yeah, like when you look at the brain waves of a person that's asleep, it's quite distinct. So you have brain waves that we see when a person is awake, with their eyes open, with their eyes closed. So we have beta waves when a person is awake with their eyes open, alpha waves when the person is awake with their eyes closed and drowsy. And then a person will enter sleep, and the brain waves are distinct. They become slower, as a general rule, as you get into deeper stage of sleep. So we have two stages of light sleep, what we call N1 light sleep and N2 light sleep. And then we enter into deep sleep, or N3, or slow wave sleep, or delta sleep, where we see the preponderance of delta waves, which are high amplitude, low frequency brain waves. So it's very distinct in the sense that the brain waves are slower, and your brain activity is at probably most rest. That's also the time when your body releases the bulk of its growth hormone. Involved with muscle and bone repair, and we're done growing vertically. It's involved with I already mentioned fixing any damage to your muscles and bones, but also it's the time when our glymphatic system is probably most active, probably at least double to 66% compared to wake. And then after that, we enter REM sleep, or dream sleep, rapid eye movement sleep. So the reason why they call it REM sleep is because in that stage of sleep, your body is completely paralyzed, but you'll see that the person will have quick eye movements. And it's the time when we do most of our dreaming, things that are vivid, emotions and complex situations and, happy dreams and nightmares. Those are the stages of sleep, and they all play a role. But if we're talking about, the ones that stand out most, I would say, in deep sleep, or delta sleep, or slow wave sleep, we'd like to think that it has involvement with declarative memory consolidation. So declarative memory being, what percentage of light sleep or deep sleep is there? When was George Washington born? Right? Facts, like things that you would study in the, in textbook to pass your exam. People like to think that in REM sleep, it has to do with procedural memory consolidation. So, if you're learning how to play a piano or something like that.
So, right. So consolidating and learning while you're sleeping. I mean, I'm thinking about my students and how important it is not to disregard or to neglect your sleep after you've studied, right? Is there, I was going to ask you this near the end of our discussion, but since we're here, is there a ideal timing as to when you should go to bed after you've studied?
I don't think that there's an optimal time, timing, like how many hours, how many minutes you should, go to bed after you've done your studying, but rather, the duration, is it going to be sufficient?
Right.
For you to be able to get through all the cycles of, light sleep and deep sleep and dream sleep.
Right.
So sleep duration is going to be, playing a part of that, but I don't know about the timing. I don't think so.
Now you mentioned sleep duration. I think, there's a lot of, not misconception, but people often misconstrue time in bed with time sleeping, right? And if you divide the two, you've got sleep efficiency. Can you tell us a little bit about that and how important it is to have a high sleep efficiency rather than, or correct me if I'm wrong, what's more important, time in bed or time spent sleeping?
Well, I think sleep duration and sleep efficiency are both important metrics to measure a person's sleep health. So like, if a person has low sleep efficiency, meaning that the time they're actually asleep divided by the amount of time they're in bed, if that's low, it's indicative of a person that might have insomnia.
Right.
Whether it's a problem falling asleep or staying asleep in the middle of the night, or waking up too early, or a combination of all three. But we have recommended sleep duration for for people of different age ranges. The younger you are, the more sleep you require because of growth and brain development and learning. And as an adult, let's say a person who's age 18 to 64, the recommended sleep duration is 7 to 9 hours, and obviously, that's part of a bell curve, right? So you're going to have people on the left and people on the right of the center. And if you're 65 and above, the recommended amount of sleep is 7 to 8 hours according to the Sleep Foundation. So, I think getting adequate sleep is one of the easier, like low-hanging fruit for us to stay healthy when it comes to a sleep perspective.
Now, what about the idea of, here's another metric, sleep regularity, getting to bed at the same time every night or consistently sleeping those 8 hours. How important is that in your experience?
The most important thing is actually waking up every day at the same time.
Waking up at the same time every day. Yeah. Interesting.
Yeah. Your sleep time is probably going to be different from night to night.
Sure.
Depending what you did during the day. So as an example, if, we went to the gym for an hour or 2 hours, it was like a strenuous day, whether it's physically or mentally. Like if you had to, work on 3 projects and hand in like a portfolio,
right?
The more strenuous mental exertion that you had and physical, you're more liable to sleep earlier in those nights compared to the days when you're more relaxed, right? Like if you're just, spending time with family and, relaxing, watching television or swimming, lying down, whatever, hanging out in your pool. So night to night, the time when you go to sleep might be different, but to wake up every day at the same time is most important because your wake time is a proxy for the time of first light exposure.
Okay.
Which entrains your internal body clock as the start of the next 24-hour cycle. So by having a consistent wake time, your internal body clock is stable all 7 days of the week, right? What you don't want to do. Yeah. What you don't want to do is to have a huge difference between let's say weekdays, classically speaking, versus weekend wake times.
Right.
Because the difference, right, is like a form of social jet lag.
Right. Social jet lag. That's yeah. You don't get much of that when you have young kids, though. You usually have at the same time every day, whether it's weekends or not. But that's interesting. And that is something that, people go through life, weekdays, working hard, getting up early. Weekends might be the opposite, right? That's an interesting way to put it. Now, for those that do have trouble falling asleep, there's this idea of sleep restriction therapy. What's the idea behind that?
Sleep restriction therapy is one of the most efficacious ways to improve your sleep and to reduce insomnia. Mm-hmm. So, the basis of this, how this works is that you're harnessing the natural drive to sleep the longer you're up, right? During the daytime.
Right. Yes.
So sleep homeostasis. I think it makes sense to all of us that the version of ourselves that's been up, staying awake for 20 hours is necessarily sleepier than the version of ourselves that's only been up for 14 hours.
Right.
So the longer we're up and away from the bed, the sleepier we become. So if you have low sleep efficiency, meaning that, you're lying in bed wide awake for a larger proportion of time compared to somebody else or compared to yourself when you're feeling more healthy, one way to increase your sleep efficiency and decrease the time it takes for you to fall asleep in the time that you're up in the middle of the night is simply by delaying your bedtime. Make yourself stay awake later.
Right.
And you can do so by, not sitting down and, ensuring that you're standing up and you're walking around. Just avoiding your bedtime until later so that you're harnessing this natural sleepiness that's going to be increased.
Now, I've heard people talk about basically the same concept, but they're laying in bed, can't fall asleep. So, after a certain period of time, let's say 45 minutes, 1 hour, they'd get up and maybe go for a walk. Is that falls under the same concept?
Well, I mean, it can be. So, I mean, these are all the, like, pieces of advice that we give people with insomnia, right? So let's say it's at the beginning of the night or in the middle of the night for that matter. And, you've been trying to fall asleep and it feels like it's been a long time. Or you wake up in the middle of the night and you're trying to fall back asleep and it's been a long time as well. It feels like a long time. Then we tell people to get up out of bed, go to a different room. So what we're doing there is that we're breaking the association between your bed and wakefulness. Because sleep is subject to conditioning, to psychological concept of conditioning.
Oh, right. So I've never thought about it that way. Yeah.
We know about, Pavlov's dog.
That's right.
Right. So in that experiment, the famous psychologist would ring a bell as he would feed his pet dogs. And after a while, you ring the bell with no food, and the dog's still salivating in anticipation of the meal because the two stimuli are associated with each other. So sleep is just the same. So, the more times you're lying down in bed wide awake, the more associated you are with wakefulness in your bed. So we want to break that. So hence leave the bedroom, go to some dimly lit room, somewhere else, do something boring, like a word search. And every 15 minutes, you're going to feel that head nodding feeling that tells you to go back to bed.
And now, because it does require a period of training, and in your experience, how long does this sleep restriction therapy have to be practiced before you get to a normal homeostasis? I mean, I know it's different from each person. It's hard to say, but is this something you do forever?
No. We use sleep restriction as part of, like a bigger therapy called cognitive behavioral therapy for insomnia. CBT-I, which is, 5 components. So sleep hygiene, education, stimulus control, sleep restriction therapy, cognitive restructuring, and relaxation-based therapy. So the combination, all 5 together, is CBT for insomnia. But, our colleague and friend, Dr. Daniel Bicey from Pittsburgh University, proved that something called brief behavioral therapy works almost just as well. Where you sort of isolate the factors, the principles of CBT-I that, provide highest efficacy. So it's stimulus control and sleep restriction, the combination, which is distilled to basically what you were talking about a second ago. What do we do if we're wide awake in the middle of the night? Leaving the bedroom, breaking that association of the bed and wakefulness, but also harnessing the power of sleep restriction. So it works great. And we see that, people are able to sleep well after let's say 4 to 8 weeks.
You use the term sleep hygiene. What is that?
Sleep hygiene is something that we've all probably heard about and practice to some degree. So it's a necessary part of having good sleep, but just because you develop good sleep hygiene doesn't mean that your insomnia disorder is going to go away. So that's an important distinction. I'll explain a little bit more later, but sleep hygiene is defined as, not using alcohol or nicotine or caffeine close to your bedtime, not exercising too close to your bedtime, not having a big meal close to your bedtime, keeping your sleeping quarters cool, dark, and quiet. And of course, trying not to expose yourself to, lights, artificial lighting.
That was going to be my next question. Is what are your thoughts on screen time? Because there have been some conflicting studies recently where, it's been a common idea that the blue light or the light from your phone is going to interfere with your sleep patterns, but then some suggest it's more so the fact that it's taking your attention, or it's grabbing onto your attention rather than the light itself. What are your thoughts on that?
I'm pretty firm that
either way, it's the device is the problem.
I'm pretty firm that the light is an issue. Yeah, like the light from our LCD screens, LED screens, and fluorescent lighting, and the cooler, more blue type of light, as opposed to the more yellowish soft light that we like, inside homes. Our eyes have receptors that are designed to pick that up, that kind of wavelength light, which, historically speaking, as we're evolving as human beings, represented sunlight exposure.
Right.
We get the most brightness of light and also plenty of that kind of light from the sun. But, with the advent of industrialization and artificial lighting, that will trick your brain into thinking it's daytime. So why sleep? So it also impairs, physiologically, let's say this secretion, a natural secretion of melatonin, which is a chronobiologic agent. It means that it tells your internal body clock when to do what and where.
Right. If anybody has any doubts as to the eye's ability to affect your biology, you look at SAD, seasonal affective disorder, right, and treatment with light panels, right. So it's definitely a thing. Now, I want to ask you about the glymphatic system, because this is a fascinating. Many people, anybody who studies biology knows of the lymphatic system. The system that's involved in the immune system, the lymph nodes, the lymph fluid that flows through the body. But it wasn't until 2012 where the glymphatic system was really finally identified by Mike and Nedgard. But what's interesting about it, and that's the idea. Or why don't you tell us what is the glymphatic system and what is its responsibility?
Well, I mean, it's sort of this new pathway for which, the waste products of our brain get shuttled away. And it's a very recent discovery, like you said. And I'm pretty sure that the person in that group, they're probably going to win the Nobel Prize for this.
Yes.
That's where all the waste products of our brain get shuttled away. It's not as simple as, your lymphatic system and, your blood circulatory system. There's, this other space, the glymphatic system. And the more we learn about it, the more we realize that, keeping that system active and healthy, is a means to maintain our cognition, our ability to think and remember and plan things and do things that are complicated. It's probably associated with our risk of developing dementias, problems with our brain later on in life.
Right, because some of the protein buildup in the brain gets removed, tau protein and plaques, right?
Yeah.
Which has a correlation with some of the neurodegenerative disorders like Alzheimer's. Now, what's interesting about the glymphatic system is that it was identified recently, but not a new idea. Even Aristotle in 350 BC had his treatise on sleep and sleepiness, where he talks about vapors coming out of the body, going into the head, condensing, and then removing stuff from the head. Not just him. About Aristotle. There was also, in ancient Chinese medicine, Indian medicine from 1,000 years ago. So it's interesting that those concepts developed and were finally proven on a scientific level.
Yeah, it's great like that, right? Like, when
so cool.
When you have people will imagine the theoretic basis for which things work, but we don't have the technology to elucidate it until later on, and it gets proven by technology. And that's where we're at with this.
Right, and some of the observations made thousands of years ago, animals lying on the side of a hill so that they could drain that glymph from their brains was one of the ideas from my research preparing for the podcast. The way people used to sleep with blocks under their heads, to drain that mystery fluid from the head as well, right? Now, when all of these things don't go well, people often seek out, doctors like yourself, and I'm talking about just poor sleep and having poor productivity during the day, but there are some very serious conditions and pathologies that can occur. What are some of the more common things that you see come across your desk?
Yeah, like I think everyone's hip to the fact that snoring is associated with sleep problems, like sleep apnea, which is basically just a person whose airways are closing up when they lie down to sleep at nighttime due to gravity or other factors. Basically, if you do that regularly enough, you're exposing yourself to greater risk of high blood pressure, diabetes, heart attack, stroke, depression, sleepiness and fatigue, problems of memory and concentration. So by way of referral bias, people refer what they're most familiar with. We see a huge proportion of people with sleep apnea and sleep disordered breathing. We see a lot of folks with problems falling asleep and staying asleep. Not just as an issue where it's a temporary symptom, but rather something that's entrenched. So what we call insomnia disorder.
Right.
So, and that's the type of insomnia that demands treatment. These are people that have a problem falling asleep or staying asleep or waking up too early. And their nighttime issues cause a daytime problem. So a problem at work, a problem at school, or meeting your familial obligations and demands. And it's present for 3 times a week for 3 months. We know that if you meet that criteria, it's not going to go away on its own.
Right.
And it causes significant health problems, whether it's mental health issues or physical health problems. We also see a lot of people with restless legs, restless leg syndrome, which translates to sometimes leg movements in sleep that decrease their quality of sleep at nighttime. People that sleepwalk and sleep talk. So and then people are excessively sleepy to the point where it's completely all consuming. So people with what we call central disorders, hypersomnolence. So things like narcolepsy. Right. Where, the person has to sleep all day essentially.
Interesting.
Yeah. I mean, talking about quality of life issues, not just poor sleep efficiency, but when it turns into something serious like that. Now, sleep apnea. I mean, I know I can count on two hands personally, friends, family members that have sleep apnea. And is this something that's always existed? Or is this something that's a modern phenomenon? Or is it something that we just now are able to identify? Or has it always been around?
Yeah, the answer is it's all three.
Okay.
So first off, sleep medicine is such a new arm of medicine.
Yeah.
It really didn't exist until the discovery of REM sleep at the University of Chicago. And then, from people understanding the physiology of sleep and then looking at what's wrong with sleep, disorders of sleep. So the fact is that, when we look at sleep breathing disorders, this isn't something that, people were hip to until maybe, last, let's say, since the mid 70s. Obviously people were looking into this historically for a long time. Most famously, Christian Guilleminault, who is a neuropsychiatrist at Stanford University, who's famously described sleep apnea, one of the first people who described this condition. So people have always had sleep apnea, but we didn't understand it to be a health condition,
right?
Until let's say a more modern type of medicine. But also it is increasing in prevalence, for the reason the entire world is gaining weight, right? So, weight gain and increased weight is a major risk factor for the development of this condition. And, our treatments really are also contemporary, the concept of wearing CPAP mask, by the way, the development of which was influenced by, people here in Toronto.
Oh, I did not know that.
Yeah.
Very cool. Very cool. Now, I wouldn't say most, but in my experience, anecdotally at least, people who become aware that they have sleep apnea, it's because they're sleeping with somebody and they're being told, hey, you stop breathing, you got to get this checked out. What's your recommendation for people who sleep alone and might not be aware that this is happening? What would be the first signs that this is happening?
That's a good question. So, if you have a informant, right, then they'll a bed partner, or like a family member, you share some space, you go to a hotel, you're on a trip,
right.
You snore terribly, you sound like a freight train, and then you pause your breathing. Okay, well, that's the sign. If you're by yourself, then, having excessive daytime sleepiness, maybe, a sleepiness that's not, your usual self, something that's new. To the point where, sometimes people might actually fall asleep while they're driving.
Yeah.
Or, during a quiet time in a meeting, they start falling asleep. So if you have daytime sleepiness, that's one sign. If you have a high blood pressure as a diagnosis, if you have a thick neck, if your weight is higher than, what would be expected for your height, if you have a depression that doesn't go away, and then, of course, we can leverage technology now. So a lot of the health devices, consumer grade activity and sleep trackers, have FDA, American authorization to screen for sleep apnea. Now, it's not a diagnostic tool, but
it's the first step.
Yeah, it'll flag for you to maybe talk to a doctor. So we see that being present in the Apple Watch, but also the Samsung Galaxy Watches, the newer ones.
Very cool. Yeah, talk about technology evolving, allowing us to progress a field of science. That's really, really cool. Something that people don't often think about as well are the different ways that you can approach sleep. And these are these terms that they may have not heard before, but we've got monophasic, biphasic, and polyphasic schedules of sleep. Monophasic meaning you sleep in one chunk, 7 to 9 hours. Biphasic, you sleep at night for some period of time, then you take a nap. And then polyphasic is a combination of those: sleep, nap, sleep, or just all naps. Is there which one of those is as a sleep medicine doctor would you recommend?
Well, for as a rule, and I really believe in this, based on all the science and what we understand about sleep, is that the monophasic model of sleep is most healthy.
The simplest one.
That's right. it's sort of what we've come upon, in the advent of artificial lighting and our current lifestyle. It's what aligns us best with our internal body clock and the way that our body works. So essentially what we're doing is we're aligning wakefulness with light when the sun's out and rest when the sun is down. And that seems to it's the way that people have evolved.
Right. It makes complete sense.
Yeah. Because, there's bodily processes that make more sense when it's dark out versus when it's light out. Mm-hmm. During the daytime, we should be stronger. We should be at our cardiovascular peak, maybe, other things that are, spent more time done at rest, make less sense. Right.
There's this sort of, I don't know if I'm not sure that there's any evidence to suggest that Da Vinci actually did this, but he was a proponent of polyphasic. Now, the reason why people would do these biphasic or polyphasic sleep patterns or schedules is to try to be more efficient with their time, right? Spending less time sleeping, more time working. Is this just a recipe for disaster?
It's a recipe for disaster.
Yeah.
Like, at the beginning of our chat, right? Like, we talked about time being the most valuable resource.
Yeah, that's right.
So obviously we all want to figure out a way, right, to minimize downtime. I mean, I really wish that we had 48 hours in the day.
Yeah, like a Mars day, right?
A Mars day, all the different things I would love to do.
I agree. I've said that so many times.
Yeah.
But then maybe I'm sleeping for 16 hours though.
Yeah. So I mean, targeting, right? Minute, or at least and what people are thinking about, like how to conceive it, how do you make, sleep most efficient by reducing total sleep duration by, the various ways that you mentioned. The problem is that scientifically, when, people have reviewed this, geniuses and sleep medicine, etc., there's no evidence that it helps, and there's a lot of evidence that it hurts. So, just to highlight a couple things, there's actually a paper done out of Netherlands, 2024, looking at people who are experimentally put on the polyphasic sleep schedule, which is a person has 20-minute nap every 4 hours.
Right.
So you end up having 2 hours of sleep per 24 hours.
Right.
And it was extremely difficult to keep. So of all the participants that they had, only one person was able to achieve it longer than 4 weeks. And then, there's health problems, right?
Yeah.
So you have worse mood, you have more irritability. Your cognitive functioning is worse. Your reaction time is worse, slower. And then also, there's physiologic things that people can measure. So we know that a person that does polyphasic sleep for a sustained period of time, their growth hormone release is extremely suppressed. And it's because when you sleep for such a short duration and in that pattern, you don't allow yourself to secrete the necessary, amount of growth hormone that's able to sustain life.
Right. And this recipe for disaster, if anybody's a fan of Seinfeld, season 7, episode 18, Friars Club, Kramer tries polyphasic sleep. Not a good idea. Have you seen it?
I haven't seen that episode, but I'm a big Larry David fan. So
yeah, season 7, episode 18, Friars Club. Now, you mentioned now growth hormone a couple of times. Now, what's the correlation with alcohol consumption and growth hormone release while you sleep?
Well, I mean, I think if you overdo your alcohol intake, it's going to suppress things.
Right.
By the way, when you drink alcohol, right? The amount of light sleep and deep sleep or dream sleep you have is different than regular sleep. You get less deep sleep and less REM sleep.
You're being fooled into thinking that you're having a good night's sleep.
I think if you have a glass of wine or two on those nights, for most people, it means that they fall asleep quicker. But also when your liver processes the alcohol inside of your body, you have the opposite effect. You get the withdrawal effect, which is you wake up in the middle of the night and you can't sleep again.
Yeah, that's right. Or, more than 1 or 2 glasses, you might end up having to use the washroom a couple of times. And there you go. Sleep hygiene out the window. Now, I lost my train of thought. What was I going to say? Yes. Oh, yes. Yes, that's right. Dreaming. Why is it that some people dream and some people don't dream? And is it a problem if you don't dream?
I think that people in general, they dream the exact amount that they're supposed to have.
Interesting.
We know that, dreaming probably has to do with emotional regulation and processing of, like, let's say, periods of strong emotions, whether it's like memories that we have or experiences that we have during the daytime. It's probably like a form of exposure therapy, right? If you, experience something that's uncomfortable during the daytime, re-experiencing at night takes away that emotional valency, like that rawness that's associated with that. And certainly when we see people who have interrupted REM sleep, like, they're much more irritable. They're more likely to, externalize and, like, get angry. So we what's interesting is also that we see we see increased REM periods and duration and frequency in people who have mood disorders like depression.
Increased REM. And
antidepressant medications they decrease REM. They suppress REM. So, I think, naturally speaking, we don't need to manipulate the amount of REM that we get. What we get is probably what's right.
Interesting. Do you ever see in your clinics the opposite? Somebody dreaming too much? Is that a thing?
I see that particularly in people who have, like, let's say, or like I'm not going to talk about, like, absolute periods of REM and, like, what's the REM proportion night that you're spending in REM sleep. But as an experience, like, when just even today in clinic, like, I saw a bunch of people that had PTSD, post-traumatic stress disorder. And we've gone through something that's horrible, like, a situation where they almost passed away. Their bodily integrity was, like, threatened, and it stayed with them. And, they get re-experiencing symptoms. And oftentimes they have, nightmares, very vivid type of nightmares that are recurrent. They often have to do with what they experience, whether it's an experience in war or, like, they got hit by the TTC.
Yeah, right.
Or like a policeman that had to save somebody from, like, after being hit by a subway. Like, these things stay with them, and they remember the dreams so vividly, and their sleep is non-restorative. It's like, exhausting. And when you look at it, what's interesting is that when you look at a person in REM sleep, their brainwaves, it looks like as though the person's awake. The only difference being that their body's completely paralyzed. So
So they're completely active in a brain sense, but they're paralyzed. So it's non-restorative. That's an interesting way to put it. You're out for a good period of time, but you can never catch up once this becomes a problem.
It's in the context and association with, like, let's say, like a depression or a PTSD. It's something that needs to be looked at.
Right. Okay. Now, we live in an age where people, and this is a great thing, I think, you as a doctor, you'd agree, people are wanting to optimize every aspect of their life in terms of health, cognition, performance. What are some of the best things that people can do in terms of their sleep hygiene, sleep practices that can help them optimize their performance day to day?
Yeah. Like, first off, like, the very first step I tell people is to wake up every day at the same time. Monday to Friday, even on the weekends. If you prioritize sleep, as, like, something that's important to you, that's what you're going to do. So finding, what is reasonable wake time that works for you every single day of the week, that's the part A. And then you set an alarm to have yourself wake up every day at that same time. And then go to bed only when you're feeling sleepy, which can be different from night to night, so that you're not forcing yourself to go to sleep by a certain time, which will be a recipe for insomnia, right? If you don't feel sleepy. Okay. Exactly. That head nodding feeling. Right. And we see that, right? If you go to a meeting for, like, 45, 50 minutes, you look around, people are, like, involuntarily nodding their heads.
So just let them sleep then.
Exactly. So those people, they might have a sleep disorder. Maybe. Right. So yeah, go to bed only when you're feeling sleepy. Try not to take naps during the daytime. If you're an adult, 18 to 64, you might not, if you take a nap during the daytime, particularly if it's too long, when I say it's too long, more than half an hour, in duration, that's going to take away from your nighttime sleep, right? Whereas we want to consolidate that sleep at night, fall asleep quickly, stay asleep the longest we can. And then, practicing good sleep hygiene, right? The things I mentioned, exercising, but not too close to your bedtime, having, decent, having a good diet, but not having a big meal close to your bedtime, no nicotine, light exposure, caffeine intake closer to your bedtime, making sure your sleeping quarters are cool, dark, and quiet. And then, having the ability to troubleshoot, right? So if you're up in the middle of the night, like I said, don't make an association between your bedtime and your bed. If it feels like it's been a long time, just go to a different room. Do something boring, like a word search.
Right. But don't go to a device.
Don't go to a device.
Right. Yeah. That's counterproductive. Now you mentioned, that head nodding feeling, which is a great feeling when it's time for that. What would you say to somebody? And I've heard this from many people. I need to leave the TV on because I can't fall asleep unless the TV is on, or I'm going to stay up until I get that head nodding feeling, but they're in front of the computer or in front of the TV until that happens. Are those two things counterproductive? Or if it gets you to fall asleep or get that head nodding feeling, is that okay?
Well, everyone is different, right? So, there's no such thing as, a black or white rule. So there may be people out there that are they're so conditioned by the sound of
that word again. Yeah.
They're so conditioned by like a certain show. I knew patients, if they stayed late enough to watch Jay Leno finish the Tonight Show and then transition to Conan O'Brien, that by hearing Conan O'Brien's intro music, they would start feeling sleepy. So, for those people, if it helps, so be it. But
I know that exact scenario. I know somebody that was exactly like that. Had to wait for Conan.
Yeah.
Yeah, that's a very good point.
Yeah.
Yeah, you've been conditioned. And
12:30.
Yeah, that's right. 12:35.
12:35. Exactly. Yeah. That's right.
At least, right?
That's right.
Yeah. Okay. Yeah. So I'll have to bring that message to a couple of people.
But in general,
yes,
right? You want to just keep things quiet. You don't want to look at a screen, right? Like, if your light is really dim and you're sort of just doing something boring, that's fine. Like, you do a word search. Like, that's what I tell everyone to do, because it's all the answers are in front of you.
Now, sort of related to delaying the sleep restriction therapy is this idea of worry journaling. Or journaling. Tell us about that. I mean, journaling. I don't know too many people that journal, but when would you prescribe that as a doctor to somebody with a problem?
Yeah, if you have a person like, and they are a worrywart, like by nature, by their character, by their personality, that they have a tendency to their mind keeps ruminating about their life issues, right, their obligations, what they have to do the next day, their exam, their mortgage, before they go to sleep. One way, a behavioral means to mitigate that is to set aside some worry time, right? So instead of having that worry before you go to bed, you're going to set aside some time during the day, not close to your bedtime, when you have privacy and you have 20 to 30 minutes, maybe even only 15, you take a sheet of paper out, you write down, all the things that worry you, put it on a sheet of paper, and, when you're done, fold it up and put it away. And by doing so, it's a way for you to take the worry and put it there and not have it come on as you're trying to fall asleep.
So you just said, doesn't have to be right before bed. You can do this, 8 hours before you go to bed, or...
What I tell people is, like, when you have time to yourself, when you have some privacy. So, like, for a lot of folks, it means, like, after dinner, or like, in that period when they come home from work and it's just before dinner and preparing for dinner, 15, 20 minutes, write down all the things that worry you on a sheet of paper, fold it up and put it away. And you're going to tell yourself, once I finish writing out what worries me, I'm not going to worry about it tonight.
Interesting. Now, this is sort of a lightning round of questions that I've got written down here. Things I've always wanted to ask a sleep doctor. Sleep positions. I know, of course, people's physiologies are different. You might have back problems. You can only sleep a certain way. But is there an optimal sleep position?
Let's say that it's probably not for the average person. Try not to sleep on your back as much.
Interesting.
Lateral sleep, left or right sleep.
Side sleep.
Side sleep. Especially because, like, so many of us have sleep apnea, right? As time goes by, we recognize that there's more and more people that have sleep apnea. And then if you lie on your back and sleep on your back, you have the worst kind of sleep apnea that you can, based on how your areas are configured. And, parts of your soft palate and the roof of your mouth, and how they get affected by gravity. You're flat on your back has tendency to close things up. If you're on your left and right side, has less of a chance to close up your airways. And then there's another level to this. It has to do with, like, fluid, how fluid will travel between your blood vessels and into your tissues and your lungs and your heart. And without getting into that, the lateral sides are best.
Right. And there's some evidence to show that the glymphatic system clears better on side sleeping.
There you go.
There you go. So yeah, I'm a side sleeper. What about you?
I start my night off in side sleep, and then in the middle of the night, I'm sure I go, left, right.
Now, what about any
back.
reason why stomach sleeping? What's the deal with stomach sleeping? Is it good, bad?
I think that if that is the only position where you're able to sleep well, all right, and you've slept like that for 20 years, and it's what you're used to, it's not going to be a habit that you're just going to break for no reason. But like I said, when it comes to optimal sleeping positions, side sleep.
Gotcha. Now, couples sleeping together. Evidence shows that from what I've read, research is that most people sleep better away from their partner. What have you seen in your practice?
It depends on the presence of sleep pathology in one of the partners. And like namely, if you have a person, if they snore extremely loudly, then the bed partner is going to suffer also, because the noise is something that it's a natural stimuli, an external stimuli that wakes people up. It takes you from a deeper stage of sleep to a lighter one, potentially, and maybe even to wakefulness, right? So if you have a person that's making a lot of noise, it doesn't have to be a person. Like if you let your pet sleep with you,
that's a good point,
right? The noise and the movement of your pet will wake you up, which this transitions us to the second issue, which is if you have a bed partner that moves around, it's very mobile and sleep, and it could be changing positions, or it could be a pathology like having restless legs in sleep, kicking you. These are all things that will interrupt, decrease the sleep quality of the other person, in which case sleeping away from each other might be best for health.
And so you've recommended that in the past to patients, not to sleep with their partner. Well, I'm wondering how that goes.
Well, I don't really have to recommend anything. The honest truth is that when patients come to me with a sleep disorder and they have sleep apnea, or if they have restless legs or go untreated, their bed partners are no longer sleeping with them anyway.
Yes, good point.
You treat the condition, you treat the pathology, it goes away, and then I take the credit for them reuniting. Yeah, right. So if a person they get CPAP, they stop snoring, and then they get back together, I tell them, it's thanks to me.
Love connection.
Just kidding.
Sleep apnea, does it ever resolve?
It depends. It depends if there was truly just like a purely anatomical issue. Mm-hmm. That can be overcome or not, right? So let's say a person Mr. X, and at age 14 at a certain weight, they had no snoring, no sleep apnea. And with time, let's say the 50-year-old version of Mr. X, they've gained a lot of weight, and it's because of the weight that's deposited itself in the neck and the tongue and the airways, the back of the throat. Conceivably speaking, if that person lost enough weight, right, their sleep apnea could go away, if they go below what we call their apneic threshold weight.
Interesting.
But if let's say, there's something that can't be overcome, let's say because their airways are just simply on an absolute basis too narrow, or if by way of their connective tissues, that their airways are extremely collapsible, or if they have, a soft palate at the roof of your mouth that hangs down towards the back is structured in such a way that it's really floppy and really likely to close up the airway, then maybe no amount of weight loss can overcome that, but for more serious interventions. So in some cases it can go away, and in some cases it can't go away.
Interesting. I have heard of cases where it has resolved, but I don't know if it was a matter of weight or not. Glad to hear that it resolved, but that's interesting. That's good to know. Let me ask you, in my last podcast with Dr. Brandon Liu, someone who personally, who's obsessed with treating sleep deprivation or working through it, he spoke a lot about the use of creatine. Once you're sleep deprived, do you have any experience with that, or is that something that you've ever considered at CAMH, or is this just too novel of an idea right now?
I'm not an expert at creatine. I think people like Dr. Brandon Liu and his partners in crime and his academic associates, they have more expertise about that than I do on this subject. So I would defer to their expertise.
Melatonin versus now it's slipped my mind. Valerian root. Any opinions on between the two?
I think that, like, I'll speak about like melatonin.
Right.
I think melatonin, it's complicated.
Right.
So it can certainly help sleep. So it's a very strong chronobiologic agent.
Right.
Our pineal gland secretes this, in relation to the light and dark cycled external environment. When the melanopsin receptors of our eyes, which are independent rods and cones which look at light and color, when the melanopsin receptors detect a drop in the sunlight, that tells us, it's, the sun's going down, it's time to go to sleep, then we have an increase in the secretion of melatonin in our pineal gland. So if you take exogenous melatonin, if you take it by mouth, it's a way to shift your internal body clock, to manipulate your internal body clock. It's certainly helpful in managing people whose insomnia is secondary to an internal body clock issue. So, namely speaking, the most common sleep disorder that's a circadian issue that's amenable to melatonin treatment is what we call delayed sleep-wake phase disorder. So these are people who sleep late and wake up late habitually. They've done so all their lives. Their internal body clocks are maybe set later compared to the average person, maybe 3 or maybe 4, maybe 5 hours. So like, we live on Toronto time and these people are living in Vancouver time.
Interesting.
Right? So PST as opposed to EST. So for these folks, if they take melatonin, strategically, they can shift their internal body clock earlier and they sleep earlier and wake up earlier so that they're able to, get to work and go to the bank before it closes normal.
How long would that take in order to shift your body clock? Which brings me to my next question about chronotypes, night owls or early risers. So how long would it take to shift a...
The answer is it depends. It depends on your age. Younger people are able to shift it, even in the absence of melatonin, just by, light exposure fairly quickly. We know that people, especially if they're after the age of 40, their ability to shift their internal body clock unfortunately deteriorates year by year. So younger people are able to shift their internal body clocks quicker. And then, of course, how one responds to melatonin by mouth. If you're taking it as a pill, that's not necessarily the same for everybody. We can talk about averages. So younger people have an advantage. The thing I want to touch on is that also in Canada, because melatonin is not prescription medication, for whatever reason, it's over the counter, even though it's a hormone, right? I don't think anyone would be okay if like testosterone was over the counter.
Right. I didn't know that. Is it prescription elsewhere?
It's prescription in Europe. It's prescription in Australia. So I guess the level of oversight is also different. So there's the study that I keep quoting, I'm quoting for, off and on for, close to a decade, which is a 2017 study out of Guelph University. And he looked at 31 different melatonin supplements that you can purchase commercially. And, they just want to see what was in the pills compared to what's on the label. And the difference is anywhere between minus 86% to plus 400+% between the different brands.
In terms of concentration of melatonin?
What's delivered as compared to what's promised on the label.
Gotcha.
And then the second part was, let's talk about the same brand, just different lots.
Yeah.
Right. So if I buy today versus, what's in the same pill from the same company, like 4 months later, a lot of variability was like huge. Also 400%.
Yeah. I can appreciate that as somebody who did molecular biology. This is a big issue. And people don't think about that when they're doing over the counter, just vitamin C, whatever, vitamin D, right? But I guess there might be a little bit of a placebo effect at the end of the day.
We just don't know what we're getting.
Yeah, you just don't know, right? So at the end of the day, is it possible for a night owl to become an early riser permanently?
Well, you can manipulate yourself and have your body and brain acclimatize itself to, like, let's say the opposite chronotype that you're naturally designed for, but the level of acclimatization is limited. So you're not going to see that a person that's a night owl will become like a morning lark completely, simply by exposing themselves to bright light, which is one way to manipulate your internal body clock, or taking melatonin, or wearing blue blocking sunglasses.
Right.
there's some things that you can't overcome.
Yeah, there are approximately from my research, there's 22 genes that night owls express at a higher level, or completely that morning larks do not. So you're battling genetics a little bit at some point. Like you said, you can't change it, so it would be difficult. Now, you mentioned age a couple of times. Let me ask you, what is it that happens, and why does it happen with age? And I'm talking about let's say the difference between somebody who's 30 and their parents who might be 70, 75. When you're 70, 75, it seems like these individuals get up really early. I think that's a common thing. I don't think I'm being mean about that. And oftentimes go to bed late. So what's going on there?
Well, so young people who are teenagers, okay, like primates, like people like us, orangutans or whatever. Yeah. We have what's called physiologic phase delay when we're teenagers. So they sleep late and wake up late. And then, once they reach adulthood, especially middle age and year by year, you have what's called physiologic phase advance. So that such that, a person will start to sleep earlier and wake up earlier year by year. And then you get to the point where, if you're talking about like a more mature, more wise age group, people who are 65 and above, they have a tendency for what's called phase advance, physiologic phase advance. Like they're going to sleep earlier and wake up earlier by virtue of that process I talked about.
Interesting.
And hence you hear stories about grandparents, right? They go to bed at like 9 p.m. and they wake up at like 4 o'clock in the morning.
Right.
Right. So that's 7 hours. So, that's what happens to people. There's a way to get around that. The way that you do that is you do the opposite of good sleep hygiene. You expose yourself to bright light close to your bedtime.
Right.
It pushes your melatonin secretion, your internal body clock later.
That's if it's a problem, right? Getting up.
That's if it's a problem.
Right? Might not be a problem. Now, you mentioned that, obviously teenagers go to bed late, wake up late. There are some arguments for starting school late because of that. What do you think about that?
I think it's on a personal basis and on the basis of sleep science and, the various professional associations I'm associated with. We want people to succeed in life.
Yeah.
And to force a teenager who's in grade 10, 11, or 12 to be at homeroom at 8:30 in the morning when their internal body clock tells them to be still asleep,
right,
and they're not fully awake until like 11 or even 12 noon is counterproductive to the scholastic achievement of kids anywhere in the world. Yeah. So I fully advocate for a delayed start time of school for people who are in their teenage years. But we get a lot of pushback, right? We get pushback from parents. We get pushback from, legislators. But it's work that continues to be done. As an example, through the Canadian Sleep Society, we advocate for better sleep health by talking to politicians, talking to MPs and senators, and, having them understand sleep science and good sleep health. And then hopefully that'll translate to investments into, sleep health alongside their pre-existing investments in good diet and exercise.
Yeah, I don't think you're going to get any pushback from the teenagers. But do you foresee a time when that might actually happen?
I hope it happens sooner rather than later. Lots of things have changed in society that we thought would never be okay, and they've come to pass. As right, people become more learned, and when we get chances to deliver our message, like doing this podcast with you, the more people that hear this, the more likelihood we have of change.
Yeah, I know there have been some experiments with that, but I don't. From what I've seen, not as extreme as what I think you're suggesting. So you would suggest that school start around what time?
Well, I mean, for a teenage school, for high schoolers, maybe 10 o'clock.
10 o'clock,
maybe 11.
Yeah.
I mean, like even if you're doing delay it for half an hour, I'm sure everyone's marks gonna go up, en masse.
Yeah.
Learning, accidents, getting to school, getting hit by vehicles, etc.
Right.
I mean, that's just one piece of it. Like, school start times is one issue, and then other issues are public health problems. Daylight saving time.
Oh, that was going to be my next question.
I can't stand daylight saving time. It makes no sense.
Yeah, especially in today's day and age where, I think the argument, you correct me if I'm wrong, was the idea around farming in agriculture. No, that's not the argument.
I'll tell you, you know what's hilarious?
Please tell me.
The farmers, they operate on solar time. They don't want daylight saving time. They have to be out there tending to like their flock, whether no matter what society tells them what time
that's right.
an hour it is.
Good
So their duties are independent of daylight saving time. And in fact, daylight saving time makes no sense for them also. What essentially you're doing when we have daylight saving time is we're taking away light exposure when people wake up and transferring it to later on in the day, closer to bedtime.
Right.
Which is the opposite of what we're trying to do. If we want good health, we want to front load light exposure close to when we wake up and have less light close to when we're trying to fall asleep. The light at the end of the day makes it hard for us to sleep, gives us worse mood, destabilizes your internal body clock.
That's fascinating. So which one of those is a bigger hill to climb, starting school late or getting rid of daylight savings time? Which one would you rather see?
Between the two, I would rather see abolishment of daylight saving time.
Yeah.
Nationwide. It's complicated, right? Because of trade with other trade partners, and they might not necessarily want to go along with the same thing. But in unison, whether we're Canadians or our cousins elsewhere, we have the same message. If you're involved with sleep medicine.
Now, we're talking about poor quality of life because of poor sleep. What are some of the more serious long-term effects of poor sleep, whether it be short or irregular, that people should be aware of?
Yeah, talking about sleep fundamentally, right? Like when I mentioned sleep insomnia disorder.
Yeah,
these people that suffer from that condition they have a much greater risk of depression, of anxiety, alcohol abuse. It's associated with psychotic disorders like schizophrenia. And we know that in certain circumstances, people with insomnia and shorter sleep duration, like if a person habitually sleeps fewer than 6 hours a night and they have insomnia, then those people are at a greater risk of cardiometabolic disorders like diabetes, hypertension, heart attacks even. Because those people, for whatever reason, they have an inappropriate activation of their fight or flight system, the sympathetic nervous activation. They have more of that compared to the parasympathetic, which is more restful. So they get more exposure to adrenaline on average, even at rest. And they have more inflammatory, more exposure to inflammatory factors, more exposure to stress hormones, and causes health conditions.
It's amazing that this thing that we all ideally experience is there's such a variability and gradient in what people experience. Some people love to sleep. They sleep so well, they can fall asleep wherever they want. I guess life's great. And then you've got the complete opposite end of the spectrum. It's amazing. Tell us a little bit about weighted blankets. This is something that I know that you've researched. What benefit are they? Are they of a benefit? Who should use them? When should you use them?
So it's something that really interests me, but I want to give credit to our very intrepid chief resident CAMH, Dr. Stanley Wong. He took the lead and he did a meta-analysis, a systematic review of how weighted blankets benefit people and from a psychiatric point of view. And looking at young people and adults, looking at people with different, mental health conditions. We think that it's going to help people reduce their anxiety, across populations. If we're talking about people who are outpatients, like people that show up at a doctor's office for appointments, it seems like there's early evidence that, using weighted blankets will help their insomnia symptoms, but also reduce depression and anxiety scores. That's not necessarily true if you're looking at its application in younger folk and people with, let's say, ADHD and autism. So it remains a topic that needs to be investigated, but we're delighted to have another tool in our toolbox. And when you think about a weighted blanket, it doesn't take a lot of work for a person to use it, right? As opposed to therapy, as opposed to medications, which come with both good effects, but also potential side effects. Right. And the way that we think that weighted blankets work is that by having that intense pressure, that it activates the parasympathetic nervous system, which is that more relaxed, not fight or flight, the opposite of that system. And we see that with babies, right? A crying baby, you swaddle them, sometimes they calm down more. Equally applies to pets.
Right. This, which is the first place I ever saw it, was an infomercial for a pet weighted blanket. So how heavy are we talking? I've never used one, so I don't know.
If you look at how people have used them in experiments to see if they help or not, then you're looking at a minimum of 10% of the body weight, a person's body weight, if you're using it.
Interesting. Yeah. So if somebody is 100 kilos, you're talking about 10 kilos.
Yep.
That's pretty heavy. But
they come in those types of
that's
increments.
Interesting. I could see, just imagining what the process would be like, why that would be comforting. Or, how I could see that. It
feels good.
Yeah, exactly. You think it goes back to some sort of evolutionary fetal.
Yeah.
Right. Cuddling up to mom, something like that.
That's exactly. There's something comforting and grounding about having pressure around you. Like it's like being hugged.
Yeah. Yeah. Good point.
Yeah. So I mean, that's what people like when they talk about, they explain, how might this work? That's sort of their explanation.
That's interesting. Tell us about your work with VR, which is a hot topic. I can tell you, and I know you know this, in education. Everybody wants to use VR. Doesn't always work. What are you saying? How are you using it?
VR is a great technology.
Yeah.
And we're at a time in the world, right, where, the quality of the VR scenarios and worlds and what you see visually are really catching up to close to what we would accept, right, as reality.
Right.
So we're not talking about a 1993 or 1994 version of this. It's highly sophisticated. So, where VR really shines, okay, is in the context of medical education or training in general, is if you have situations that are very high, high impact, high risk, but low frequency.
Right.
So if you're managing a person whose heart stopped, and in the context of CAMH, it's been used to train people how to deal with a person that's overdosed in opioids.
Sure.
Right. These are high stakes.
Yeah.
They don't happen all the time. And imagine having to practice that in real life.
Right.
In an emergency room, or in the hospital in the middle of the night. It's hard to practice these conditions in that real scenario.
Right. Your supervising doctor's not going to say, "Come here."
Well, knowing that knowing if you screw up, right? That's life or death.
Yeah.
So having VR allows us to safely practice these high stakes, low frequency situations in a way that's meaningful and gives people, the effectiveness and the courage to act right, in the right way when it comes down in real life.
Are you using it at all for treatment with behavioral therapy and insomnia? Or did I misunderstand that when I was doing some research?
Right now, we don't have. Right now, we don't have. We're not using VR to train people in therapy.
Okay, gotcha.
To train people in therapy, we are doing it in vivo, right? We have a pep talk about what we do for this week for this session, and we have a framework for what comes next based on the feedback that we get from the patient and how they track their sleep. But I can see that there's great application for VR, and it's only the use of VR in education is only going to expand.
Right.
Yeah.
Right. Okay. Speaking about education, what would be your number one tip for students that are in the heat of exams, studying, sleep deprived, stressed, anxious, all the things that you see? What would your advice to students be?
So you got to it's a matter of timing and planning ahead. So the key to succeeding and doing well in your exams and getting the highest mark you can and consolidating your learning so that you can use it and apply it in real life is to make sure that you get enough rest after your study sessions. And you can cram all you want, but you have to keep some sleeping sessions in there too.
Yes. And
the sleep sessions are actually what consolidates. It takes all the stuff that, you put in your working memory into a longer term memory or intermediate term memory so that at least you can pull those facts and put it on paper so that you can get the good marks. If you stay up all night studying, it's not going to stick. And we know that there's experimental proof that that's the case. That the sleep is what helps you.
So studying, pardon me, and sleeping hand in hand. They obviously have to go together in order to fully consolidate that thing. One or two more questions, if you don't mind. How is there anything that can, what can you do to boost the efficacy of your sleep, if that makes sense? For example, working out to get really tired. And then like, what are some of the things that you can do that you can maximize the efficacy of the restorative nature of sleep?
Sure. I don't think sleep is something that you need to like, manufacture or force
or try to hack.
I think nature has already optimized it in a sense that as long as you're addressing all the pathologies that you might have in sleep, if you snore, get checked out for sleep apnea. If you have it, get it treated. Right. If you have restless legs, get that treated. If you sleepwalk or sleep talk, get that treated. If your environment is noisy and warm and the lights are on, turn on lights on, turn the lights off. Make the temperature right. Make it quiet. Right? Like as long as you do all these things, then I think that's the best sleep you're going to get.
I think that's great advice. The number one thing that I'm walking away with here is the idea of conditioning. It's something that I haven't thought about. It's been running in the back of my head the whole time here. Linking your time in bed to sleep, or being conditioned by a partner who might be, have some sort of pathology, or the idea of conditioning or conditioning yourself to go to bed at the same time, same night. I think that's something that I'm going to take away from this. And I really appreciate you bringing that to light. If there was one thing that you wanted to sort of share with the world in terms of what you've experienced and seen and treated, what do people need to know about sleep? What is your parting message?
Well, we spend a third of our lives sleeping, so why not make it as comfortable and enjoyable as possible? If you think you have a sleep issue, get help, whether it's medically or whether it's change your sleep environment. And then that way, I think you're going to be healthy, and I think it's going to help you in your life in all facets.
Dr. Michael Mack, thank you so much. I've learned so much. I really appreciate it.
Thank you. It's my pleasure.